Okay.
We're live. We're live.
We
I see
are
it on the
live.
screen. We are live.
Do you see it on the screen?
Yes, I do.
Charlie?
Yes, I
Let's
do. Hello, aloha, Hawaii.
hang on, let me get my thing going here.
Yes.
Start watch party. Oh, hang on while I get situated here. I have yes, start watch party. Okay, hang on. Okay, welcome everybody. Oh, I cannot get out of here. What's going on? Okay, there we go. All right. Aloha, everybody, and welcome to the COVID-19 discussion with Charlie and Mel. Hope you guys having a great day. Um, just want to wish our buddy Charlie and Stephanie a happy 24th anniversary.
Thank
Happy
you,
anniversary,
brother.
Charles.
Thank you. Thank you, brother.
I know you spent your day out, what, passing out food to the community and
Yep. Yep. We
doing
did
what you
it.
guys normally do. And so, everybody, right now, type in the comment box, happy anniversary, Charlie and Stephanie.
And
Charlie,
I like to send a shout out to Jade, Y Ale Ale Batad and Poki. They were so nice. We went to pick up some food up before coming back to Waimea. They were at Safeway, and lo and behold, they showed up at the car with a dozen roses for Stephanie. That was nice. Well, I say thank you, thank you.
Kawai as
Yep,
why.
that's kawaii. That's why. Yep, yep.
But anyway, blessings to you folks. You guys are good people, do a lot for this community,
Thank you,
most
my
of
brother.
which goes unnoticed and unrecognized. So thank you guys for all that you folks do. Um, Tonight we have Dr. Scott Miscovich. You guys have seen him on the news. You've seen him on TV. You've seen him all over the place. And thank you guys for coming on early. We come on early so we can make sure everything is working. We've had a couple of boo boos early on in this thing. Now we kind of got it mastered, but just
Yep.
wanted to thank you guys for coming on early. We get to play around a little bit, talk story, and as we're seeing, this thing is filling up already. So thank you all, and thank you in general for watching this thing every single night. I ran into a guy today. I had to go into the office today to work, and I picked up a bento box from Smiley's Ono lunch. Um, so this guy he goes, wow, bro, good show last night, good show. What do you do that? You guys do that what? Every Sunday night? I don't know. We do it every night, yeah, every single night. And again, we do this because we want to inform and educate. A lot of stuff on social media, a lot of rumors grow, a lot of mistruths and misleading stories. And I posted about Alaska Airlines, um, and I found out that exactly what I thought that they would say was that there was a website glitch that would allow people to book a flight. I think the website glitch was Sue Kanoho calling them up and saying, "What the hell you guys did? What are you guys doing?" But anyway, Alaska has confirmed that they are not flying directs to Lihue, but they still are flying flights to Lihue via Honolulu. Delta is confirmed they are increasing their flights from 4 to 7 flights a week, so we will have a Delta every night. The question is, how many people will actually get on those flights, knowing that we have a quarantine here in Hawaii? So all of these airlines websites have a little button they can click to learn about the restrictions in the area that they want to travel to. So of course it's a little banner, but nonetheless they do let them know that there's a 14-day quarantine. But again, as we've talked about so often, um, where would you rather quarantine? You rather have a stay-at-home in New York or in beautiful Lihue, Kauai? I bet they pick Kauai more than not. So anyway, throughout these discussions, we've been talking about the necessity of testing, and that's why we've invited Dr. Miscovich on tonight. He is with Premier Medical Group on Oahu. He has been running tests, and he'll explain all of this tonight. But he has been doing the tests, the widespread testing on all three of the other islands. We're trying to get him to Kauai, and he'll explain what the process is. But we do want to get him here because I think many of us agree that we're not testing enough. And I think the more and more you watch across the country as people are thinking about opening up their counties or cities or states, the one common denominator is that they're all saying we got to have testing. You got to really have a lot of testing if we want to start to talk about opening up the county. So Dr. Miscovich will be here shortly. I told him 7 o'clock. He's a doctor. He's probably very good with time. If not, we'll have Dr. Charlie Iona talk about testing
Yes.
tonight.
Yes.
Charles,
yes.
what's your take on testing here, Charles?
Well, I'm a firm believer. I mean, it's like anything else. If you want to get your driver's license, you ought to get tested, right? Because we can't be putting people on the road that doesn't know how to handle a machine that can possibly kill. So you need that mechanism to make sure. And in this case, with testing to find out if the virus is spreading, because the thing that I would hate to see is it spreads so far and fast that we're not able to, like when you go fishing, you surround that big school akuli, right? If the thing is so big, you're not going to be able to capture that school. And this virus is not like on fish where you can come back tomorrow and catch them again, because you don't catch it right the first time, it'll catch you right the first time, and it'll do you in. And so that's my whole beef with this testing procedure. And I like to say, I had some comments. They thought I was rather emotional last night. I'm emotional because I just worry about a life. I just worry about a life. I don't want nobody to get sick and die. I mean, my years working at the Honolulu Medical Examiner's Office, get called from the Straub, get called from Queens. I have to go up to the room, examine the death, whether it's natural or unnatural. And, just to see families there, and it pains me. And this very same virus can do that. It can cause families to, leave the hospital with one family member less. And you don't want to leave that way. You want everybody to come home. And, I got good news. One of my good friends from my police department, her husband had a family member in California with COVID. He was pretty bad. 30 days on a ventilator, 30 days. And like they say, the longer you go, the chances slip away. But miraculously, he recovered. So he's that percentage that he fought hard and he made it. And I wanted to say congratulations. I'm happy. And he's recovering and he's heading home after 30 days in the hospital. Unbelievable. So I know there's success stories out there. But I think right now, Mel, as you know, I don't think we have enough space, enough ventilators on this island. Should something happen real quickly, it's going to overtake us really fast. And I just don't want nobody to get hurt. That's all.
Well, that was always a concern. The resources, the hospitals, the ICU beds, the ventilators.
Yes.
They say if you get on that ventilator, 50% chance you will die. That's just the statistic. It's not a good one, but it is the way this virus is. Once it gets to that point and it's embedded in your lungs, 50, once a ventilator gets hooked up, 50-50 chance. So prayers and blessings to your friend, man. That's good news. Yep. We forgot to talk about our shirt, Charles. Here we go.
Yes.
Hey, everybody. To those of you that have sent orders in, thank you very much. We're slowly getting to our goal of $5,000. We have actually got shirts are being ordered from the mainland. It's incredible, but we have a lot of shirts. I texted the order in to Kirk today. Kirk Korea is doing all these shirts for free. He is not taking a penny. He's not taking the cost of the shirts. He gave us the shirts. Charlie and I, here we go. Yep, there it is. Charlie and I decided that $10 would be a good amount that, most people could afford. And all $10 will go to the Hawaii Community Foundation. So if you are interested, just shoot me a private message. I got money today. I got $15 on PayPal with no explanation. I didn't get an order for a shirt. So I don't know if that was just a donation, but I reached out and hopefully that person will respond to my email. But anyway, send me a private message. I'll send you a PayPal or a Venmo link, and we'll get you guys that shirts. And those of you that
Yep.
ordered already, we should have the shirts in the next day or two, and Charlie will take care of delivering on the west side. I'll take care of delivering on this side, and we'll get it going. I am getting a little worried because it's 7:04.
Hey, brother Mel, I would like to ask the viewers, and they're good investigators. That's why people that tune in, they ask all the right questions. But I would like to know if anybody on Kauai, okay, I'm going to ask you for help. And this is like an APB. If you find any store that has Pillsbury orange rolls, I would like for you to let me know, because I noticed that when the toilet paper went out, the orange rolls went out too. You can only buy croissants and cinnamon rolls. And I hate cinnamon rolls. And I've been looking for orange rolls, and I've been promised so many times that it's coming in, that it's coming in. And when I go to the shelf, I go to the manager and say, APB, we are missing. So I said, did you guys give out toilet paper and one complimentary roll of orange rolls? Is that the reason why we don't have orange rolls on any of the shelf? So ladies and gentlemen, if you find the Pillsbury, the little can, when you hit them on the side of the table, you hit them on your spouse when they're acting up, and the bug pop open and says orange rolls, let me know. I'm going to love you forever if you can find that, because I'm in so much need for that orange rolls. I just can't find it anywhere.
I
Is
can
that
ask
Dr.
Patsy to make you some orange rolls.
Well, I think it's the it's just the joy of watching that thing pop open and just like the can giving birth, like poof, thing pop open.
Orange rolls or holly brownies, Charlie?
So since you brought up holly brownies, I have to go with the holly brownies. Kamehameha School's favorite, holly brownies. Yes.
Couple of things going on. I know that in anticipation of more flights coming to the state, more flights coming to Kauai, people are asking about rental cars. Can we shut down the rental cars? And I thought about that today, and I haven't spoken with the mayor's office, but I would assume that you could consider the rental car businesses as non-essential. Unless you're a local resident. If you're a local resident, your car broke down, you got to rent one car. But I would think that it would be, I don't know about this, but that it might be in the authority of the county to say, hey, effective tomorrow. Here he comes. Thank goodness. We was running out of like jokes. Anyway, just a thought. Just a thought. Hey, just say you're inessential. Shut down. And so here comes Dr. Miscovich now. Thank you for you guys' patience, everybody. You guys are great, by the way. The best audience we've ever had. Of all the shows that we've ever done since the inception of time, this audience, Charlie, don't you agree? This audience for this show has been the best of any of the talk shows we've ever done.
Hey, this is
Even though
better
this is
than
our only talk show.
the Johnny Carson cannot touch this audience. Johnny Carson cannot touch this audience.
Well, anyway, Dr. Scott Miscovich.
Hey, team.
Thank you so much, my friend. You're a very popular and famous guy. Probably one of the most sought after people to talk to during this COVID-19 crisis. My name is Mel Raposo. Obviously, I'm from Kauai. That is Charlie Iona, also from Kauai, formerly from Maui. We're both former cops, and now we're talk show hosts.
Wow.
And your agent was very generous with us, so I really appreciate you joining us today, Doc. And we're going to turn this thing right over to you. And you, if you can, just give us a brief introduction about yourself. We are concerned, as many are, about testing, and we hear about you all over this state. One of the things you said that really struck me on your KITV interview, which I actually copied and put it on my Facebook page, and we got a lot of views, was when you said you're more concerned about the white areas on the map, the areas that were not being tested. So anyway, I ain't gonna steal your thunder. I'm gonna switch this thing over to you, Doc, and please take it away. We do have some questions that we'll pop at the end of the presentation. So again, thank you for being here, though. I appreciate it.
And hey, thank you guys for having me. And I'm going to challenge you. There's no such thing as former cops, right? You know, because I take care of a bunch of police officers in my practice. And so you guys, once you're cops, you're always cops, man. I know that. So thank you for your service. Yeah, well, let me just tell you a little bit. You know, I'm a family physician. I've been in Hawaii over 30 some years, and I, have a group that I've started, and I have about 15. Now it's up to 18 medical providers, about 100 and some employees. So I'm not small by any means, but we're a private practice. And when I started to watch this happening, I started to, I'm a real wonk on studying what happens. And I've been very fortunate to be on medical missions all over the world. And I have had some FEMA training and public health training and epidemiology training. When I started watching this going on in China, I really started to get worried early, back even in early January. And I made a large purchase of the personal protective equipment, just anticipating this. And then I started to really track it more closely, and I really became concerned when we had people coming with coughs and things that were not being identified as normal infection. Their x-rays were different. They had no flu. And then I started to look at our arrivals, and we all know this in Hawaii. We had what? 250,000 people a month coming from Asia. So we have this blaring infection going on across Asia. And we have people getting off the plane, and my flags went up, and I just started to press hard to know that we needed to start testing, and we needed to start being serious about this. So I rallied my troops together, my team, and I have amazing staff that I just said, we're going to do this, because I studied very deeply, and I had some connections in South Korea, and I started watching the model that South Korea was putting together, because they were the early success story. And I used my resources to study how they did their drive-through testing. And that's how I first started to model and develop our drive-through testing. And that's where it started. And then we piloted it. And I'm a collaborative leader. And every time we ran a drive-through testing, I'd bring my team together and I'd say, okay, what can we do better? How do we improve this? And we kept doing it again and again and again and improving it. And all that time, the whole key was listen to the people we serve, listen to the people of Hawaii. This was about the people and getting them the care they needed and identifying if COVID was present. And so that's kind of the beginning. That was the genesis of this. It went way back into January, and it started with trying to learn from what South Korea did well in some other countries. And then the credit really goes to this incredible team of employees and now volunteers that I have, which are incredible right at this stage.
Doctor, let me ask you, you said that you noticed something that was different. Can you tell the viewers, I guess in layman's term, because a lot of times everybody's still confusing this with the flu. And, there's got to be different characteristics about it. And if you can just explain to them in layman's term, what's the difference? What do you see as it being different?
Before you answer, Doc, before you answer real quick, everyone share this right now, because I think that the next hour is going to be awesome. Hit your share button, start a watch party. Do that right now. It's important we get this out to everyone. Apologize. Go ahead, Doc.
Sure. Yeah, that's a really good point. It's a great question, because I still get asked this when people just keep trying to say, what's the big deal with this? Because, we have flu, and flu kills a bunch of people, and why are we making such a big deal over this? Well, we now have the largest group, because our testing has identified close to about 200 of the positives that are in the state, if not more now. And I'm calling every single one of those. So every single positive in the state that we've gotten, I've called, I've talked to them. They have my cell phone. I follow up. I periodically check in with them. And there's multiple phases of this. The one is I get people saying to me, Doc, I get 2 colds a year that are worse than this. And you're calling me and telling me I got COVID. So some of them just get a little snibbly nose, a little bit of scratchy throat, not much, and it goes away. And then there are others that will get a little bit of the classic dry cough, but it will still not be much more than a regular cold. Now, there is a whole nother lower group, easier group that are not problematic. And this is something that we need to tell the listeners and viewers to look out for. About 20% of our population have a dramatic loss of taste and smell. And this is written up in our literature across the world. Now, we've all got stuffy nose where you can't smell your food or taste it, but this is something where it's gone. They maybe get a little bit of saltiness at the end. And that now in our literature has become one of the most sensitive questions to ask someone. And this is especially clustering in that 18 to 40-year-old age group, right? So if you are out there and you are someone who got just even mild respiratory symptoms, and all of a sudden you say, like, what happened? Why can't I taste or smell? You need to go get checked, because that's a very, very sensitive symptom. Now, these are clusters of people who are going to do pretty well. Now, let's talk about the bad part. This virus, when I talk to the people, and I've had 2 of my patients were on ventilators, both of them survived, and I've had numerous others that were in the hospital. So when I talk to these people and call them that they're positive with COVID, within the first 2 minutes, they've already coughed 40 times. They are just coughing their lungs out. And it's this dry cough that's just so progressive, and it just goes on and on. So it is nothing really mild. And then those people in a very short period of time, and this is what makes it dangerous, will go from just like a really bad cough where they're just kind of have a gallon of Robitussin at their bedside, to within about a 36-hour period will crash where they will walk 3 steps and they can't breathe. They just get so short of breath. And usually within another 36 to 48 hours, they're in a ventilator. So that is what really separates this disease from other things, is it's a very, very, very rapid decline. And we know from the physiology, it's that literally the lung tissue is literally being eaten away by this virus. Because by the time they're into that last 2 days before they're going on the ventilator, they're just coughing up gobs of blood and tons of secretions, because their lung tissue is starting to be liquefied. And then their kidneys can shut down and their heart can be affected. And, so that's the danger. And that's what separates this from the flu, because the common flu will get you some flu pneumonia, but this just, you crash and burn so fast that it's scary.
Well, no one knows that, Doc. No one knows that better than Mr. Charlie here. He lost his brother a couple of weeks ago to COVID. He was in New York.
Oh my God.
Yes.
Yeah.
Wow.
His symptoms, exactly what you said. He talked to me on a Sunday. By Monday, he was already admitted. By Tuesday, he was on a vent. And by Thursday of that week, they were already talking to us about dialysizing, not 4 hours a day, but 24 hours. And his blood started to, it gets really, the viscosity so thick that they gave him, heparin to thin it out. It was like, it just went downhill from there. I mean, it's.
Oh. Wow, I'm sorry to hear that, but here it is. I didn't even know that, but you just described to a T what we're experiencing, and you described another thing which is very unusual, which is actually the exact opposite of what we see in other types of advanced infections, where these people are getting these very thick blood products, and essentially then they start throwing blood clots all over. And it's the other way around. When you usually see someone with a severe infection, their blood thins, and you're having to give them tons of platelets and tons of things to try to get their blood to clot, because they start bleeding. But for multiple physiologic reasons, this disease is nothing like we have ever seen in modern history. And when it comes to those people that advance to the poor stage that your brother went to. So people need to take it serious. And the whole key is, God forbid, we just need to stop people from even getting to the disease or getting to that level. So, wow. And New York, I mean, my God, look what's going on in New York. It's just crazy, just so scary.
Yeah.
Doc, we have a question about treatments using hydroxychloroquine. Is that something that you use here in Hawaii?
No, I mean, hydroxychloroquine is available in the hospitals, but there's a big misconception about what that does. The medical science is very, very clear. It does not cure the disease. What it does is, it's been used as an anti-malarial and in other forms of tropical medicine, has other uses. But the bottom line is it just helps to reduce some of the inflammatory processes that are coming. So when we talk about a disease and some of the things we're trying to see the world will be able to do, you talk about something, will it kill it? And so that in a medical term is called, is it virucidal? Meaning that like an antibiotic kills the bacteria. Do you have a pill that kills the virus? This does not kill the virus. This basically just takes away some of those odd inflammations that happen, and it may make it a little easier to get through it. So will it help some people? Are there studies showing it does? Yes. Is it the answer for this? No. And will it be the answer? No. The most of the jury's already back that it's only going to be an adjuvant for a few people.
So, Doc, testing, your pretty much your expertise now. You said you tested at least 200 of the positives, maybe more. You're still waiting test results to come back.
Right. Yeah.
How many tests have you, your group performed?
We're probably about half the tests in the state right now. So we're probably closing in on 12,000 of the tests that we've done. So we've done about half of them. And our data probably shows that we have about the same percentages, probably just around 2% positive. And when you look at a testing percentage epidemiologically, when you do these big mass group screenings, that is, if you look at us compared to some of the civilized countries who have done well, a 2% positive rate puts you right on target for doing the right testing. To give you an idea, so people I don't want to wonk out too much on them. If you're doing a test in your country and 1 out of every 10 is positive, you need to do a heck of a lot more testing, because that means you got so many people out there that are still positive that the fine line from an epidemiologic standpoint is that 2% mark that shows that you're finding the right amount and you're testing the right amount for the state.
And you're currently testing on 3 of the 4 islands. You're not here on Kauai yet, right?
Correct. We're not on Kauai, and I think I did mention. I think if the mayor ever wanted us, would come. But I think Kauai feels pretty confident where it is. It sounds like you guys are fairly stable. But yes, just to give you an idea, just right before I came and jumped on, I was just working with Maui County and Mayor Victorino's team, and we're sending a team back over on Thursday, Friday, and Saturday. We're going to do another big kahalui. We're going to hit probably Pukalani and Kihei, which haven't had testing yet. And then we're going to be taking teams out to the homeless encampments, because there's a lot of encampments in Maui. And we're going to be doing the shelters on Maui. So we're going to reach into those very vulnerable areas. We have a small team. We're going to be flying to Molokai, because they have a 60-person homeless encampment that we didn't hit in Molokai. And then the Big Island this week, we just did homeless shelters today. We did Hilo on Sunday. We do Hilo every Sunday. We're going to Ka'u. We're going to up to North Kohala. We're going to Honoka'a. So you can see the strategy. This goes to that white map question you brought up, Mel, which is, when you see those white sections, it doesn't mean that there's no disease. It usually means we probably haven't tested enough, because this disease is so prevalent that, there should be a marker on every one of those places if we have more than probably 500 to 1,000 people living there. So.
Yeah, that really stuck with me when you talked about the white spots, because, I think that's where a lot of us, we look at our numbers, it's relatively low, but look at the numbers of tests that we've done. The state finally posted the numbers of tests given by county, and I think a lot of that was because of our our people were, viewers were screaming, we want to know how many tests. I couldn't get the test numbers from clinical labs. I did get the test numbers from DLS, but I could not get the numbers from clinical labs. So I was very happy when the state finally put it out. But as of last week, Thursday, we had performed 1,062 tests on our whole island. Our whole island. Remember, when this started, we still had the 25,000 visitor a day population.
Right.
So if you add all the people that were on this island from start till today, 1,062 tests. Not surprising why we would get such a low number.
Yeah, and that's a good point. I'm glad you're using good common sense analytics. You don't have to be an epidemiologist or doctor to do what you just did, to know that you probably need to get a little higher percentage of tests done, and maybe reach into some of those communities that need a little more direct personal outreach, which is kind of what we're doing now. Because I love your island and have been there, coming there for 30 years, and I know every corner of it, I believe. But the bottom line is, here's a perfect example. If you look at those tests per county, now look at like Maui County. Maui County had 2,000 and some tests when they enlisted it today. Well, guess what? Over the last 10 days, we did 2,000 of them, our group, when we went over there. And so prior to us going to Maui, they had only had 400 tests or 300 tests done on the whole island. And same thing with Kona. When we went to Kona for the first time, I think it was 3 weeks ago today or 4 weeks ago today. It's hard for me to remember. And we basically went over there on a Monday, and we did a big drive-through. That first drive-through, we popped about 20 positives because no one touched them. And they had so much tourism, because that's where this came from. I mean, you're contacting tourists, and they were coming from all over Asia, bringing this to our islands.
Okay.
And that has always been our concern. Charlie, go ahead. Charlie?
Yeah, Doc, many have asked if someone who is asymptomatic, we always hear the term asymptomatic. Yep. And they could be carrying the virus, but yet they should have none of the outward signs. Why are they not allowed to be tested? Right now, the state has put up this thing where they said, well, you got to be in close contact. And our thing has always been, Mel and I, we've been pretty much beating the drums that, we want to do what Korea does. And that is, hey, maybe the person you're talking to when they do the contact tracing or the trace contact or whatever you call it, that maybe that person doesn't know me, but we might be back to back sitting in the same restaurant. If you just give the info out that they were at this restaurant, I think we can take it from there. But for some reason, they're not giving that information. And so why are they not being tested just to rule out the fact that, I was there and I don't have the virus? Why?
Well, that's a great question, Charlie. And it's a difference between they and us, because our group has we have incredibly bright people I'm working with. We will do all the journal reviews from today, what's going on across the world, and we modify our criterion every single day when we go out there. So let me give you a perfect example. We went over to the island of Molokai. Well, there's a grocery store over there called Friendly's, right? Mm-hmm. And that is the place when you live in Molokai. Well, there was, and I'm not giving up any confidential information, there was a worker at Friendly's who became the first positive. Well, if you checked a little further, this person was out there, man. This was a well-known person, and the people liked him, and there were people around this person all the time coming in and out of Friendly's, right? So when we went over there, we were very considerate of if you were in Friendly's and you were shopping in Friendly's. So we were much more broad to test people that were contacting him in that grocery store, which did leave us a broad swath of people, but we felt that was safer to do that than not. Now look at the corollary. Look at what happened at McDonald's in Kona. Look at that. You just got a pack of people. Look at what happened in Maui Memorial. You have 50 some people. Well, and let me tell you about Maui Memorial. We did the testing at Maui Memorial. My last 11 positives out of Maui Memorial since we did were all asymptomatic contacts. They all worked in the same department as some of the people that were positive, and we tested them because they worked in the same department and we knew who the positives were. And if we weren't aggressive like that, we would have never found them. So what you are saying is 100% correct. There is a difference, though, between having that contact and testing and doing pure random screening of everybody walk up in the whole state and everybody just get a plain test. We will get there at some point, but we are not there yet. But eventually that's coming. Everybody should know that's eventually going to be here.
Okay, thank you. Now, some have asked about the testing procedure because we hear that you need a referral, and yet there's some that says, no, you don't. And as a follow-up to that, Doc, you talked about the symptoms earlier. Now, I guess there's a panel of symptoms that you went through: dry coughs, fever, all that type. Is there a minimum that you have to have, or is there something where you're looking for, like, at least if you have 5 of them, you're looking for 3 of the 5?
No, that's a good question. And unfortunately, I think that's one of our problems that we had in the state of Hawaii, that our people that were leading us were following early January's data coming out of China, which said, unless you have a dry cough with a fever and chest heaviness, you can't get tested. That is so passé. We know so much more about this disease. And as I mentioned earlier on, we just get people with a little scratchy throat and lost a taste and smell. I get people with just fever and achiness that just feel mild, just like early flu symptoms, and they have it. And I'd probably say right now, maybe 30% have coughing with a little fever. So no, that the majority of the people have different symptoms. Now, one hallmark is most all symptoms are upper respiratory, because remember, this is a novel respiratory virus. So there are some new literature showing there's a little bit more diarrhea in some people, but that's probably 10% or less. So almost everything is right up here. It's in the chest, it's in the throat, it's in the sinuses. And yet, as we move forward, we do have asymptomatics. And this is pretty scary stuff, Charlie and Mel. We're guessing that now the data is showing 20, 30%, upwards of 40% of the people carrying this virus may be asymptomatic. And that just is putting us as medical professionals into position of trying to broaden that search out the right way to identify those people. Okay, so you have this asymptomatic, and Mel, this is my last question because I'm going to dive right into it. But Doc, if what you're saying under this a new discovery of asymptomatic, I call it an asymptomatic pattern because now it's becoming a pattern that's pretty obvious. And the state wants to open up the tourists to come back. Knowing what you know, do you think they're making a right move? Or, I mean, some people say, we can deal with it, but I don't think we're prepared to if you just let the floodgates open. We're going to get creamed. No chance. No chance. I mean, we are so far away from having opening our tourism. I mean, look around the world right now. Look what's going on. Just look across the United States. We still have some cities that are still just devastated by this. I mean, New York, where unfortunately your brother was, I mean, they just started to slow down, but they have they still have 800 deaths a day or 900. And I mean, Louisiana, and we're still seeing Detroit. I mean, these places are running out of body bags. So, I mean, and then we're still looking at some of the smaller cities and even some of the smaller rural areas are at a little delay where they're still not even addressing it, and they're going to hit their peaks in another 2 or 3 weeks. So we are a long ways away. And I was talking to some of the people at our drive-through today because I just have such incredible volunteers. And a lot of us have volunteered at different places around the world. And one of the people I talked to today, we had both been to Africa doing volunteer work. And if you've ever gone through Nairobi or into Johannesburg, and you look at these slums where people are stacked on top of people, they're going to not even be able to count the bodies in those places. And it has entered there. And I mean, worldwide, most of us are predicting you are going to see 10 million people die of this or more. We're just starting to see it hitting the Central Americas, South Americas, and these broad cities. And this is a devastating disease. So for us to think that we're just going to open our doors, this is going to ask for the disease to come right back in. So not yet, not yet.
Okay.
Doc, I've had a question, and it looks like about a specific testing you did on first responders back in April 9th or 10th. They're asking if when the results will be coming. Not sure if you're familiar with that specific test.
I will have my, let me see, what's today? Those should be, it depends on where it was. Let me explain about the testing. This is really important. I'm glad you're bringing this up.
This was on Maui. It was on Maui.
Yeah, okay, it's on Maui. Yeah, I believe that today's the 20th. Yeah, I believe all the testing should be done by right around today. But let me explain something to everybody listening about the testing, because I'm going to talk about the old times, which was kind of the challenging news or bad news, and then the new times, which is great news. So we were doing all this testing, and a lot of all the tests were being sent to diagnostics or clinical labs, which are two big laboratories in the state. They would then try to process a few of them on island because they had some capability, but most were being sent to their mainland affiliates. The mainland affiliates, it would get into the queue of whenever it would arrive, and they were getting them shipped in from all over the world. So we were getting some people's tests back in 3 days, and we were getting some back in 13 days. And it didn't have anything to do with DLS or clinical or us. It just depended on when that mainland lab got it and how big their queue was. So that was frustrating for us as the providers who wanted to let people know, but also frustrating for the patients who were sitting there on pins and needles wondering if they're positive. So I want to apologize to everyone, but explain that. Now I'm going to tell them the good news. As of Friday, so this is Monday, a couple days ago, Diagnostic Laboratories is now pushed their capacity on island, 24 hours turnaround, to 550 tests a day. Clinical is 250. That means we now have 800 tests a day, or 5,600 tests a week, that can be done on Oahu. So to give you an example, we were up at Kahuku for the first time. We did one on Saturday. I have every test back from Kahuku already. The tests that were done yesterday, that were done down at Kaka'ako, by the time either tonight or I wake up tomorrow, they're all done. So we are now on queue for people to get their labs back within 24 to 48 hours max, most of them coming, which is going to be great for the people of Hawaii.
That is definitely great news. I know there was always a concern about how long. Another question, if someone was in contact with someone that was positive and they were tested and it was negative at the time, are they required to take another test a week later?
No, they're not required, but knowing what we know about asymptomatic positives, I would encourage them to not let their guard down. And the first thing I would tell these people is, okay, you were around the positive, you got tested and you're negative. Well, what happens if 3 days later you start coughing? You go right back and you get tested again. Don't wait, because we just might have been a little bit early to find it. And then we're gonna maybe branch off to another thing that is kind of one of the answers of how we open the state up, and that is the future of what are called antibody tests. And I can talk about that if you want to get your questions. I'm on your lead, guys. It's your show.
Please, yeah, if you could. I know there's a lot of questions about the antibody test. So much information out there. I did want to say though, in relation to your comments about the asymptomatic, the other day they printed a report about the USS Teddy Roosevelt. 60% of the positives on their sailors were asymptomatic. 60%.
Exactly. Exactly. And you could take the same data back and look, because they also did the Princess Cruise Line, or yeah, the Princess Cruise Lines. Same thing. They were finding 20 or 17% on one, and I think the other was almost 40% of the people were asymptomatic positives. You could take the Kirkland, Washington nursing home. Large portion of those were asymptomatic. Another big data point we look at is Iceland. Iceland had a few big communities that had an outbreak, and they have a pretty advanced health system. And they went in and they just scanned the entire community. Same thing, 40% of the community were positive and asymptomatic. So we're getting a lot of data coming out that shows that's a concern. Yeah.
And that is one of the problems we're having here. And I know I can tell you right now, you won't see the comments. Please go back and check the comments afterwards, Doc, because there's a lot of comments. But you'll see, and I'm sure they'll mention it. We've had several people that has been experiencing these symptoms. Went to the doctors here on Kauai, had a flu test done, came out negative, and sent home with a Z-Pack or other antibiotics, and not tested for COVID. So that is a big concern of mine. Now, real quick, before we get into the antibody, the talk about shortage of test kits, shortages of PPE. I know you talked about this on your KITV interview. How are you getting your kits? And the state is supposedly, they don't have enough. They need to conserve their kits. And what I heard Dr. Anderson say on a press conference was, we're conserving our kits and we're really only testing the people that we believe are positive. What's your take on that?
Well, I think I've been pretty outspoken on it, because I think it's just absolutely false. And I just don't believe that there's a total lack of communication by anyone at the Department of Health to talking to the people who are dealing with these kits. And every time I watch that every day, I just shake my head and say, why, how can you even say that? And here's why. I talk at least usually once a day to the presidents of diagnostic labs and clinical labs. The lab kits are procured by them, right? They buy those kits, and then they make them available to, whether it's a hospital or an urgent care or an organization like mine who's out there trying to do it. Now, here's the way we did it. I will call them and say, okay, how many kits do you guys have on hand? How many do you have on order? How many do you think you're getting in next week? How many are you using per day? What's the average days on hand? It's good science. I don't care if you run a bake shop. You need to know how much flour you have and how much is coming in a week. And so I asked them common sense questions, and they're both wonderful people. And we understood that that the hospitals had to have priority. Well, at any given time, they never went less than 6,000 test kits on island. Most of the time, they had 8,000 to 12,000. Do the math. We've only done 20-some thousand the entire 5-6 weeks. I mean, we always had a couple weeks on hand, usually 10 days on hand, and there were always more coming in. So every time I'd hear Department of Health say, oh, we don't have enough testing material, I'd be like, well, who are you talking to? Are you actually talking to the sources? Because apparently they weren't even checking that out. So that's always been not true. And then the other thing is the PPE, that's the personal protective equipment. Essentially, the PPE is readily available. So when you hear this PPE shortage, I think that just refers to the fact that most of the hospitals and healthcare institutions are waiting with their hand out for the free stuff from the federal government. Has the federal government stockpile been very, very well tapped into and very much spread across the country? Yes. So is there a shortage of free PPE? Well, yes. But is there an absolute overabundance of PPE that you just have to open your wallet up and go buy? It's fallen out of the ceiling. So I have 10,000 masks coming in tomorrow. I had 500 of those full white Tyvek suits brought in today. I could have ordered 10 times that and have it here. So when I hear the Department of Health, or I hear other organizations and hospitals saying, oh, please send us some of your free stuff, I'm just like, These are $3 masks. The N95 on the market, they're so plentiful, are $3. Are you not going to pay for your nurse in your emergency room or your ICU to get a $3 mask when you can buy them literally? Mel, I could send you pricing sheets where I could buy 1 million at a time. And these are legitimate vendors of people that are very legitimate people here in the state who are dealing with this. So there's no excuse for hospitals, first responders, or anyone not to have all the adequate equipment to protect them. So I feel very strongly we need to protect our first responders, our nurses, our doctors, even the nurses' aides, the people who are cleaning the hospitals. They all need the right protection. They're sacrificing right now. I do want to go back to say something about the test kits. Remember, the test kits are basically you get them from the insurance or from the laboratories, diagnostic and clinical, and they do all the billing for those. We don't have any financial involvement with that. So they buy them, they procure them, we ask them for them, and they basically then will bill the insurance carrier. So this is important for people to know about the drive-through. So there's two things. Number one is that we do have to collect your personal information like your name and address and phone number and your insurance card, because then that is turned over to the laboratory, who then gets your HMSA or your Kaiser or UHA or your Medicare to pay them to run that lab test. That lab test is probably about $100. And we have no part of that. Now, here is the other thing that I'm going to give them a lot of credit for. We have then determined that we will never turn a person away. In this type of pandemic, I never want to have someone walk up to me and say, I just lost my insurance, I don't have insurance, I don't have money. So both of the BLS and clinical have agreed that if someone comes up, they will not charge them. So in essence, there are people, if you have no insurance, you have no money, it's free. If you do have insurance, you will not have a co-payment. That is by local HMSA, by Medicare. So in essence, someone might consider that that's quote unquote free, but it is costing the insurance companies who are taking it on the chin monies to still cover their members. So the most important thing is anybody can get tested and they will not have a penny out of pocket.
You know, Doc, I think what you said is so true in a sense that because of this disconnect with the DOH, and I think the citizens of Hawaii, you know, they're relatively smart people. They can figure things out, and then when they hear this, that's when there's this a sense of distrust comes in. It comes into play. So that's why they're begging, hey, I want to go back to work, because if they're so, you know, somewhat dismantled on the top there, they can't, you know, on one hand you can get the equipment, on the other hand they say you can't. Then they just say, you know what, just let me go back to work already. And it's just not working for the cause to do it right, so we don't have a big spread occur. Because that's the tsunami that I worry about. Is that when that tsunami comes, you know, right now we've got buoys out there that can give us, hours leeway to run to safety. This thing, once you get it, you're just knocked. You just get it, and either you survive it or you don't. Like my brother, he talked to me on a Sunday, and he found it perfectly fine. He just said that, I got a little cough, but the doctor said if I can go 3 days without coughing, then bingo. I call him on a Monday. I don't get a call from him, only to find out he's admitted on a Monday. But by Tuesday, I can't talk to him because why? He's in a ventilator already.
Wow.
So I think these people got to realize the thing is so fast. If it does move on you, like you say, you got to get your personal affairs in order. He didn't even have a chance to do that. It was that fast.
Yeah, it is. It's a horrible disease, and fortunately, a lot of people survive. I've had numerous people in their 80s, and they did fine. They did fine with it. It's just so hard to tell. Science is trying to figure out, why do certain people get it and get no symptoms, literally asymptomatic, and certain people, like, there's that gentleman who is 38 or 39 in Strop on a ventilator, and he was otherwise a healthy guy. How's a 38-year-old just, it looks like he may survive, and because I'm taking care of some of his family members, but still, how does that happen to a person at that age, or happen to your brother?
Well, look at the most recent death in Maui that they just announced, the number 10, the 10th death. No underlying conditions. They don't tell you his age, between 40 and 50 or whatever. I mean, I can't believe why the state is so secretive when it comes to letting the people know. If you have a chance, go to my YouTube channel and watch Minnie Cole. She was our guest night before last. If you just go to my YouTube channel, we have we do this every night. And in fact, tomorrow night we have Lieutenant Governor Josh Green. He'll be on. And he mentioned, when I asked him, what's our testing capacity in Hawaii? And he said, we have the testing capacity of testing about 1,500 people per day. And this was a while ago. I can't remember when he was on our show last, probably 2 weeks ago. And that might have grown since, I'm not sure. But we definitely have more capacity than we're using, and I think that's the frustration. But Minnie Cole is not a doctor. She spoke to us about the processes. She actually did her Zoom from South Korea. She lives in South Korea, and she had the opportunity to go into the situation room with the government, and it was an amazing presentation. But testing is the key. Testing is the key. I mean, they test, and they test again, and they isolate.
Amen.
You got to watch it, Doc. You would appreciate it.
Hey, Doc.
And go ahead, Charlie.
Let me ask you something. When we talk about someone getting tested and they test positive, we hear about people going home and being under home quarantine. I kind of look at that as like, you got your kids at home and says, here, cook your food.
Mm-hmm.
And they're only 5 years old. And you're asking them to turn on the stove and cook. Because I look at it like when I was married before, and when my wife was going through cancer treatment over at Straub, the room next door to her, because they was using those nuclear isotopes for throat cancers and stuff like that. Isolation was, nobody can go in or out. Everything is lined, everything is radioactive. They got all that things. So if someone is tested and they test positive, if they were to go home and they say they live with a family of 5, they should make arrangements where the other 4 shouldn't even know it be near that person, correct?
Thank you very much. I've been saying this for 5 to 6 weeks because, again, I went and studied the South Korea model. Germany is another perfect example, and South Korea did the same thing. But Germany, I'll give you an example. They had what they called a COVID taxi. The minute you were diagnosed as positive, they sent people in gear to your home. They picked you up and they put you in a quarantine ward, and you were put right there, and all your food was provided. Everything was there, because it is impractical to have a family household where you can think about it. How do you quarantine where you have this massively infectious disease and you live in a classic Hawaiian household where we might have 12 people in the same roof under 1,400 square feet? Look at how many of our people struggle, and we have so many generations under the same roof. I have asked for this again and again and again with no response, that we have all these empty hotel rooms, but we should have a quarantine hotel that should be up and going. And I've heard a lot of, we're working on it. But this is something where you got to act on it. You got to do it now. We should have done it 3 to 4 weeks ago. And those people should have an option. Now, let me give you a perfect corollary. Say you're a 28-year-old couple, and you live and you have a 1-bedroom or 2-bedroom or something, and you're both young and you're both pretty happy. Could you potentially kind of hang and have your significant other take care of you? That's probably not that bad, because your chances of getting bad disease are not bad. You got another person there caring for you that's probably not going to work. That's probably not the end of the world, right? What if you live by yourself? What do you do if you're by yourself and you're supposed to quarantine? You know, we didn't address this, and we still haven't made a good move to address this right now.
Yeah, that when Minnie shared with us what they do in Korea, same thing. They don't call it a COVID taxi. They just call it the government officials. They come to your house. Their labs run 24/7. They hit a positive. Two things happen. They send out the troops. They yank you out of your bed and they put you in an isolation facility. The second thing that happens is they get a countrywide alert that goes to everybody's cell phone that tells them that someone just tested positive in the district of wherever. Go to our website to find out the details. On the website, they don't say the guy's name. They say where the guy lives, where he works,
His
and
age.
how old he is. Yeah, and how old he is. And that so now you know, Doc, if this guy, take for example, Kona McDonald's, that case. I mean, the media had to use a opihi knife to get that out of Dr. Anderson. He didn't want to answer the question. But how many people went to Kona McDonald's in that period of time as a customer,
right,
that are asymptomatic? They ain't gonna get tested. Now, if that positive came out and everybody's cell phone went off, you went to the government, and not only the government website, they put it on all the government social media accounts, Facebook, Twitter. Now you go on there and you say, holy moly, Kona McDonald's, I ain't going. But this state is not doing that. This state will not tell you anything. And that's what's frustrating. Charlie and I has been pounding this for so many weeks now, and no one listens. And you've been saying it, the lieutenant governor's been saying it, but they're just not interested.
You know, one thing that I noticed that they don't do, and maybe you can clarify this, that if somebody does test positive, Korea will immediately go in, shut that business down, disinfect it before opening it back. Do they do that here? I mean, I see it on the news, but you know, if like Molokai, did they disinfect? I'm pretty sure they disinfect that store. But what about the other areas the person came in contact with? I mean, did they even bother going disinfecting that? So you know, we can take all the precautions, but if nobody goes through the disinfection process, we're having a live virus that potentially can climb on a person, right? And then you become that carrier.
Well, okay. I mean, yes, they should be disinfecting it. I agree with that. But there is something that everybody needs. This is a good segue to answer this question. The virus will live on like linoleum or stainless steel, maybe up to a couple days outside. But let's take a perfect example of, say, Friendly's. You know, the store. They shut that place down for almost 3 weeks. There is zero chance, disinfected or not, that a virus particle is still alive in there. It cannot live on without a host for a period of time. Now, should they go disinfect it? Yes, but would there be any risk of that? No. So on an acute phase, like for example, if that McDonald's try to open back up 2 days later, you're damn right you better go clean that place up and clean it up really, really well. So yes, you guys are correct. There has to be disinfected. And second thing is, most of that is borne by the businesses or the workplaces, and it is really, really expensive. It's really expensive to get full disinfected because, as a matter of fact, when this started, there was a team of people that needed to get fitted for masks, and we do occupational health. And we fitted like 80 employees to go get OSHA certified for masks because they knew that they were going to just be run through the ceiling. And they actually already had like 50 businesses that wanted to get sterilized. So it's a business to be in right now. It's an important business for customer safety. And also, as we go back to opening our state, it's going to have to keep happening. We're going to have to find a way to make this a natural way of life to keep a business operating, because you may have like trying to open like a small retail store, but at the end of the day, you're going to want to clean it, right? Because, you know, people are in there touching things or they're touching, you're going to have to clean it. We're all going to have to find ways to try to live in a more sterile, clean environment. So it's a good point.
Thank you.
A couple of real quick questions. How long does this virus stay in the air after someone coughs?
I like to use the analogy, although it's not perfect, but it's at least a fairly good visual of vaping. You watch people vape out there in the trade winds and watch, well, those are micro respiratory droplets, and watch what they do, right? So if you're in trade winds, they go. And that's why I always teach my patients, and I've said this in my media appearances, use the trade winds to your advantage with COVID. If you're around someone, don't be downwind from them, be on the upside. If you're talking to someone, have a crosswind so that neither of your respiratory droplets are coming at each other. Tilt your body so you're talking. If you're in your home and you have family and you're trying to sit around still social distancing, put a fan and blow it across between the people and open up a window on the other side. So where you run into trouble, which is why you see the USS Teddy Roosevelt and the cruise ships, is when there's not a lot of circulating air. And so that those little respiratory droplets, you know, if you're ever in a still room and you look at a light and you see those little particles that are floating around and you're wondering, what the heck, do they have wings? Well, that's just the dynamics of the science where they can hang up in the air. So in a closed room, in a small room, say you're in a 12 by 14 room and you're sitting around with a bunch of people in there for 10, 15 minutes, that is the definition of serious contact where you have a very high risk of catching this disease. So ventilation and proper ventilation moving forward should be something that people of Hawaii really start to pay attention to. And having the fans in the windows and the trade winds are blessing.
We are running out of time, Doc.
Oh, no way, man. No way. We're just getting started.
Hey, man, I got all night. You know, I can stay on all night. We got a bunch of questions, Doc.
Yeah. As
far as visitors coming in, the best solution is really to keep them isolated from the rest. I mean, this 14-day mandatory quarantine, which really isn't mandatory because they can sneak out. They all got to stop at the store to get food. But what is your suggestion as far as, I mean, we talked about the isolation facility, and you know, I don't think that's going to happen.
Well, let me segue over to this because it's an important thing that I think is our answer, and I don't want to take up all of our time with this, but I do want to mention the antibody testing. So I'm going to give just a 15-second, 20-second overview. When we're testing the swab, you are testing for what's called the antigen. That's the bug. That is the disease. That's the little particle that's causing all the havoc. When you have that get in your body produces all these warriors, and those are the antibodies that your body is making. They're coming up and eating this virus. Those antibodies are good. That's how we survive this. So we're going to hope at some day, and like we could open to tourists like next month if we could find a way that these people could show a card that's validated to show I have COVID antibodies present, therefore I am no risk. Those people could come and enjoy all they want. Same thing if you're a resident and you're found to have antibodies, you're good to go, man. You should be able to not have to socially isolate. You should be able to go to work and do whatever you need. So the proof of immunity. And then let's take it one step further. Well, how do you get antibodies instead of not getting the disease? It's a vaccine, right? That's what a vaccine does. It stimulates your body to make these little antibodies to make you safe. We're probably 6-8 months at the earliest, 12 to 18 at the latest to get a vaccine. But that antibody card is one of the ways we're going to open the state of Hawaii and allow people to happen back into work and into active life here.
But does it seem, you know, with what we're hearing, and you know, we had the senators on last night, the three of them with the COVID committee, Donovan Dela Cruz, Donna Mercado-Kina, and Kirk Favela. Doesn't it seem? I mean, I would think that would be the best approach as having that. I mean, I worked at the ME's office in Honolulu before, and they made us take the hepatitis, you know, the shots to make sure, because we're always, so, you know, they made sure that we had that in the police department. We had to take that 3-shot protocol or whatever, make sure you build up enough. So you're saying that when we get this card that says that we have the
immunity,
the immunity,
right?
Okay. So without that, and the state taking the position that they want to open up for the tourists to come in, it's almost like a no-win situation for the citizens here, because prior to all of this happening, the virus came from the outside in. It just didn't pop up on Hawaiian soil and grow. I mean,
Yeah.
we all know that. So we're kind of facing an uphill battle, right?
You know, it's like going to Vegas. The house always wins. So the tourism industry might start winning, but the people are always going to lose. You know, you can't beat Vegas because those people, you cannot just open the doors back up, because this disease is so hard to detect. And, you know, I can tell you, it is such a false sense of security to have people swipe your forehead and look for temperature. That just is such a poor indicator to know for sure. I mean, you know, you might catch one out of 40 or 50 people, but you're not going to catch everybody with a temperature check. That's a false sense of security. The only way we're going to know is knowing if the antibodies are present.
Doc, I got a question. What about people with compromised immune systems? Should we be going anywhere like the grocery store?
Nope. You should have your friends do it, your family do it, everything. There's no way you should not be doing it. Not at all. So not at all. Yeah, those people should be very careful.
We have, Doc, people already asking to have you come back. This is the first time we've had people ask for an encore to bring you back on another night.
I'll be back in a second. I love working with you guys. You're you know,
I tell you,
I'll be back in a second. It's just like sitting talking story. So, you know, I'll be there in a second.
That's why I love this format. I really do. Not a big question that everybody. See, my wife is coughing over here. I better go check her temperature, make sure to it's a wet cough though. It's not a dry cough. You know?
No. Get her tested.
No, Mel, that's a frying pan cough. You gotta get a frying pan over your head.
Is that why she's getting the frying pan right now? Not a big question, Doc. The big question. You said that you got to be invited by the mayor. You'll come to Kauai. Considering Kauai's demographics, I know we had a little text back and forth. Let's say you come to Kauai. Let's say we get the mayor. I sent the KITV interview. Like I said, I converted it to a YouTube video. I sent it over to the mayor's chief of staff, and she said they were going to discuss it the next day. How long would it take you? How long would it take you to basically get a good testing sample here, not sample, but testing process here on Kauai?
3 days. Yeah, in 3 days, you know, knowing the island, would do 3 locations in each side of the island, bigger location in Central. Yeah, in 3 days, I think we'd probably be able to get another 1,200 tests done. And then when you look at your population base, that would give us a much better sampling of where you are. So yeah, I can tell you for sure, 3 days would do it in a heartbeat.
Wow.
Yeah.
Well,
you know,
all you viewers, now you know what you got to do. You know, again, you know, all we care about, Doc, is keeping our place safe. This whole state, you know, we bring on people to share ideas and what's relevant. Because you know, the Google University and Twitter State College is not good places to get information, man. It's just not. And
no.
I mean, I'm seeing some of the comments here. I'm not going to report it. I mean, I'm not going to state it because I don't want to put anybody in a bad spot. But there's some comments here that some people are not taking this seriously. Some people are not taking this seriously. And we look at our number. We've been stuck at 21 now for, I believe, probably a week. Maybe a week, maybe a little less. And a lot of people are you know, way to go, Kauai. But if we're not testing, you know, if we tested 100 people on Kauai for obesity and then go out and say, hey, and we get, you know, we find obviously 100 people are obese, every single one of them. And then you compare that to the population of Kauai, the percentage of obese people on Kauai, very, 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 very small, not accurate. It's the same thing. When you take a small sample, when you make it so difficult to get a test done, when you got to come in pretty much on that stages heading towards ventilator city, but then they can take your test. We're not getting a good test. And that's what I think I'm afraid. A lot of people are looking at this and saying, hey, we can start opening up because our numbers are so good. The reality is, as long as we get visitors coming in, we saw what happened on Maui. Minnie Cole talks about patient number 31. Patient number 31, one person infected over 100 Koreans.
Yep.
In just their daily walk. So I'm actually worried, and I think we need to get you over here as soon as we can to get some testing done. I mean, I really do.
Hey, Doc.
Yes.
Let me ask you on this this 2-week quarantine or isolation.
Yes.
Someone tests positive. They should be retested before they go back into the general pop, right?
No, and here's the reason why. Because remember, right now we're still using that antigen test to show is the infection there. This is where the antibody test is going to be more valuable. So the guideline for returning back to the population, now all of my positives, I tell them 14 days from the date of the test. And okay, now let me just do a brief explanation of why. When you take the data, the shedding, when people were still spreading the virus, at about 14 days, you're down into the mid to upper 90% where most people are not shedding. When you get out to 20 days, almost no one is shedding. So once you get past 14 days, we already know statistically, there's probably single digits of people who still may have a little bit of virus. I don't want to be too gross, but actually what's interesting with this virus, which is odd, is in the later phases, we're finding a lot of it sticks around in the stool. So you got to be careful with bathroom and cleaning and stuff like that, especially like people, hotels or public areas. But the thing is that the other guideline is, so say you're at day 14 and you're still coughing and you're still sick or maybe having low-grade fever. Well, no, it's common sense. You're still not going to be released back to the public. Your body may be having a hard time fighting it off. You still may have active virus. Most of us believe 20, 21 days is good. But then let's flip it around. What are we looking for? You get that antibody card. What that shows is your body's locked and loaded with enough of those warriors to kick the virus. So therefore, you're good to go. So that's what the key is. So that's the test you need to go back to work eventually, or to say you're safe to go.
Okay, so that percentage, you say 90%. So we're talking about a 10% window that should have single digit numbers, right?
Right.
Is that single digit number enough to say if it lands on someone that has a immune deficient, the system is compromised? Is it enough to hurt that person?
Yes. Yeah, they still could be shedding. So that's why that's why following the quarantine instructions is very, very important. That's why that 14 days isn't just pie in the sky. That 14 days is based off of, studies to show when people are still having that virus coming out of different fluids of their body. And, we know what the body fluids are: the cough, the nose, the secretions of the mouth, the saliva, and the stool. So, it's real. You got to do 14. And if you even still have a snibbly nose, or you're coughing, or you're still feeling stick it out another 7 days. Be safe.
Okay. Thank you. Thank you.
Last question, because Minnie Cole talked about, she said I think the longest stretch that someone had, because they don't let people go until they test again and they got to test negative and so forth. But they found one patient that had the virus showing up after up to 35 days. And that, very rare case, but that's basically what happened. The other thing is, as we're reading about South Korea, they're finding that some of these patients that got the virus, recovered, are now getting the virus again. And they're trying to figure out if is it a new infection? Is it a resurgence of the same virus within the body? And I don't know. They don't know. She was saying they should have the results of their studies in the next couple of weeks, which I think is going to be very helpful for the rest of the world. I don't know if we've seen that here. Have you seen that in any of your patients?
I can answer that, both of those questions, and they both have similar answers. And I think there's more data coming out from what Minnie was talking about. So the first one is, there was a mention of immunocompromised people. So say you're immunocompromised. So what that means is your body's ability to make those antibodies to fight it off is slow. It's knocked down. So those people are struggling to put enough of those cells in there to beat off the virus. Therefore, it lasts 35 days. So that's why an immunocompromised person could go on and could either die from this or really be beaten down from it. So that's the perfect example. Also think of someone who's older. Their immune system and their bone marrow and places that make bone cells, they may be really knocked down. So that is true, what you're saying, but it's pretty unlikely and it has specific circumstances. Then the second question is, most of the data we're seeing in the last 5 days now is, I'll make a comparison, and I've used this before. A lot of people have heard about mono, infectious mononucleosis. Well, that's a virus. So what happens with mono is you get it right at the beginning and you got a sore throat and you got a fever and you feel lousy and you cough or something. You go on for about a week. And then your body starts to mount a little bit of a healing, and it knocks down and you're starting to feel like I'm almost better. And then a week after that, boom, a little bit of it picks back up, doesn't go quite the whole ways up to the ramp, and it lasts another week. And your body starts to mount more infection response and it knocks it down. And then maybe one more little belch of it comes out, but it's not as bad. That's what we're believing we're seeing, is the virus kind of replicating where your immune system is not quite building enough of that immunity up, and it knocks it down, it knocks it down. So most of us are not believing it is reinfection. We're believing it's just that long tail where you're still wrestling with it and your immune system is fighting it off. So, which is much better than having a whole new infection again.
Okay, Doc. So I guess one question that just popped up, and maybe I kind of asked the question earlier, and maybe I didn't clarify, but going back to that, the antibody that you have, and there's that single digit window that you may have some left in you. Now you finish your quarantine period, you leave, you go back into general pop. Is there enough in you that if you were to cough it out then, that you can infect someone who has an immune system that's very low, or none at all?
Everybody's going to be different. That is a question that science probably hasn't studied enough to know. So that's a very good question, Charlie. And the answer is truly God only knows at this point. Not able to tell that. We do know that there's a higher likelihood is in the stool that there's a higher quantity at the very end phase of this, where people can get infected from not washing hands and things like that. But from a coughing perspective, that dovetails over to the other question that we're trying to ask is, how much of that virus is shed during the asymptomatic carrier period, and where in that asymptomatic carrier, at what time period? Is it shorter and only 7 days, or is it the full 14 days? Or, we don't know that yet. We don't know.
Okay. Thank you.
Wow. So Doc, you ready? You're willing to come back for an encore? You know,
hey, man. Yeah, you bet. You tell me. This is good, and it was pretty good because my dog's only barked about 3 times. So
we have, like I said, we have Lieutenant Governor Josh Green tomorrow. Wednesday night we'll have. On Wednesdays we break up the week with a little bit of humor. We have Frank DeLima and Augie T will be on.
Man.
Yeah, it'll be fun. It'll be hilarious, and we're trying to get some other speakers lined up for Thursday and Friday. We're looking at getting someone from the Hawaii Community Foundation, as well as the Hawaii Health. What's that place called? The hospitals.
Yeah, the HHSC. Yeah, hospitals.
HHSC. Because I think I think as you'll go back and watch this, Doc, and read the comments, you'll see a lot of people are very happy when they get to hear someone like yourself answer a direct question. When you watch the press conferences, the media will ask a question, and then the person will answer, but there's no back and forth. The answer will be the answer, and then they'll go to the next question. There's no discussion on the question. So I think this is refreshing. It's great for myself. I get educated so much with these things that people feel the same way. And again, I think you're the first one. Well, I know you're the first one that we've seen the request for an encore performance. So before we head out, I just want to remind everybody we have these shirts, and these are available. Kirk Correa and his t-shirt company has donated all these shirts. These shirts are available for $10 a piece. All proceeds goes to the Hawaii Community Foundation. Kirk doesn't take a penny. We don't take a penny. And believe it or not, Doc, people are actually buying these things. So if you're interested in a shirt, everyone.
Hey man, I'm going to want one of them to go with my shirt collection, because you bet you're gonna have to put me in for one. And
yeah, okay.
Yeah.
Just message me your size and we'll definitely get you on. Again, it's I don't know why, but what the heck, people are buying them. And no one makes any money out of this except the Hawaii Community Foundation. Doc, we want to thank you again.
Thank you.
We're honored to have you here. We'll definitely get you back on probably next week.
Hey,
And,
I'm here. I'd love
let
to
you know.
talk to you. Yep. Thank you guys.
Things change so up, but you cannot leave yet, because the ending of this show is what everybody hangs around for.
Okay.
Everybody hangs around for, because we try to flatten the curve here on Hawaii. We've been trying to tell people, pound people every single night to flatten the curve. Wash your hands, don't touch your face, stay home, practice social distancing. People don't listen. Told them that if you guys don't listen, Charlie and I is gonna come out and pick you up. We'll get deputized, we're gonna arrest you, and you'll be forced to stay with us for 24 straight hours. That didn't work either. So we came up with this method that if you don't flatten, then we will flatten your ears. Ready, Charlie?
Don't worry about a thing. Every little thing is gonna be alright. Don't worry about a thing. Every little thing is gonna be alright if you hunker down tight.
Hey, see, that's how we do it. We flatten the crap out of anything we play. Ladies and gentlemen, thank you for joining us again tonight. See you guys tomorrow night at 7 o'clock. We'll have Lieutenant Governor Josh Green here to answer all your questions and ours. Take care, stay safe, you guys. God bless.
Thank
Aloha.
you guys.
Thanks,
Aloha.
Doc.
Thanks.
Aloha.
Aloha.